Module Overview. This module offers an in-depth exploration of healthcare-associated infections, HAIs, infections that patients acquire during the course of receiving treatment for other conditions within a healthcare setting. HAIs represent a critical threat to patient safety, healthcare worker well-being, and healthcare system sustainability. This module investigates the etiology, epidemiology, risk factors, transmission mechanisms, and preventative strategies related to HAIs across diverse clinical and institutional contexts. It draws extensively from WHO guidelines, CDC protocols, ECDC frameworks, and post-COVID IPC revisions, offering a globalized, policy-integrated, and multidisciplinary approach to managing HAIs. Part 1. What are healthcare-associated infections? HAIs. Definition: HAIs, also known as nosocomial infections, are infections that are not present or incubating at the time of admission, but are acquired 48 hours or more after admission or within 30 days after receiving healthcare services. Categories of HAIs: catheter-associated urinary tract infections, UTIs, surgical site infections, SSIs, central line-associated bloodstream infections, CLABSIS, ventilator-associated pneumonia, VAP, gastrointestinal infections, e.g., Clostridium difficile, multi-drug-resistant organism, MDRO, infections. Part 2. Epidemiology and global burden. WHO estimates hundreds of millions affected globally per year. Developed nations, 5 to 10% of hospitalized patients acquire HAIs. Developing nations, up to 25% prevalence in some hospitals. Economic burden, billions lost annually to extended hospital stays, antibiotic use, litigation, and productivity loss. Psychosocial impact, loss of patient trust, anxiety, depression, caregiver stress. Part 3. Causes and risk factors. Microbial agents, Staphylococcus aureus, including MRSA, Escherichia coli, Pseudomonas aeruginosa, Klebsiella pneumoniae, Candida spp. Clostridioids, difficile, contributing factors, invasive devices, catheters, ventilators, lines, prolonged hospital stay, inadequate hand hygiene, antibiotic misuse, immunosuppression, e.g., cancer, HIV, transplants, overcrowded or under-resourced facilities, poor sterilization practices. Part 4. Prevention and control strategies, post-COVID enhancements. A. Standard and transmission-based precautions, hand hygiene, alcohol-based rubs, soap and water gloves, gowns, masks, respirators, patient cohorting and physical distancing. B. Surveillance and screening. Active surveillance cultures, ASCS, real-time infection tracking software, eye-enhanced dashboards. Syndromic surveillance and contact tracing. C. Antimicrobial stewardship, rational prescription policies, avoiding unnecessary broad-spectrum antibiotics. De-escalation protocols. D. Environmental controls, rigorous cleaning and disinfection regimens, antimicrobial surface materials, negative pressure isolation rooms, UVC light systems. E. Education and training simulation-based IPC drills, staff induction and continuous learning on IPC protocols, patient and family engagement. Part 5. Legal, ethical, and organizational considerations. Ethical obligation to do no harm, non-maleficence. Transparency in disclosing hospital-acquired infections to patients. Mandatory reporting of certain HAIs to public health authorities. Legal ramifications. Institutional liability, litigation, professional sanctions, organizational frameworks, IPC committees, risk management units. Part 6. Global guidelines and standards. WHO core documents. Core components for IPC, 2016. Guidelines on the core components of IPC programs. Global Report on Infection Prevention and Control, 2022. CDC guidelines. Guidelines for isolation precautions. Preventing transmission of infectious agents in healthcare settings. UK frameworks, NHS England's Infection Prevention and Control Manual, Care Quality Commission, CQC, Regulations on Patient Safety and Hygiene, Canada, Canadian Nosocomial Infection Surveillance Program, CNISP, Public Health Agency of Canada, IPC requirements for acute care facilities. Learning outcomes. Module 2. By the end of this module, you'll be able to define and classify various types of HAIS, explain the causes, risk factors, and microbial agents associated with HAIS, apply surveillance and prevention strategies based on global IPC standards, critically evaluate post-COVID adaptations in HAI prevention, navigate legal and ethical dimensions of HAI disclosure and reporting.